guess that's kind of to scare you, but certainly to pay attention. So, endangerment sites, some of which we've talked about, the anterior triangle of the neck. And I'm going to do a little triangle. And the anterior triangle of the neck is on page, it's actually a pretty good picture of this, on page 87 in your color anatomy book.
87?
87. Page 87. And that is, this region is bordered, as it shows, by this sternocleidomastoid, the mandible, lower jaw, and the trachea. So it's, and there's two of them, one on each side, a right and left one. So basically, in terms of massage, it's anything anterior to the sternocleidomastoid muscle. Okay? And the reason for that is the contents, what is in that, what it contains, basically, is the carotid artery, A for artery. So the carotid, that's probably the most critical anatomical structure there, is the carotid artery. The jugular vein, the cranial nerve CN10, better known as the vagus nerve, cervical lymph nodes, and the submandibular gland. But as we know, when we are doing a lymphatic massage, we do go into that area to drain it down towards the insertion point of the sternocleidomastoid for lymphatic drainage, but that's done very lightly. So anytime you're in this area, you're going to be just cautious and very lightly, anything anterior to the sternocleidomastoid muscle. So down in through here. But again, the cervical lymph nodes, most of them are directly underneath the sternocleidomastoid muscle anyway. So you can use that muscle and drain straight down in this direction. With you're pretty secure doing that. And then lightly, just with a wide swath of the palm down towards that area. And because that's when you're going to be using, you'll be using the lymphatic drainage techniques, and then doing for the head and neck, and you'll be doing that as well. So, but that's what is in that anterior triangle of the neck. And again, this carotid artery is the most important structure because that is the one of the arteries that goes up to the brain. And there is a little sinus that's located in the carotid artery, and pressure on that carotid artery can make somebody pass out. So if they have blood pressure problems, that's kind of the issue. And sometimes even people that do have arterial problems will, when they're lying on a massage table, when they go to get back up, they can feel a little bit dizzy, and especially somebody elderly, or if you know they have any problems or they indicate problems, then they can get a little bit dizzy getting up off the table. So you want to be, fortunately it's seldom, but you want to be a little cautious. One thing you can do to help that problem, if you even suspect it, especially with an elderly person, is have the table, the front, the head of the table, have that, when you adjust it, have it just up one. So that their head is above their feet a little bit. And some people might even tell you that they have trouble lying down, and they almost have to be in that semi-recumbent position to even get a massage. That can happen, so just, if that happens, you can prop them up with pillows, you can, and/or raise the front part, the head of the table up to their comfort so that you get a little bit of the elevation of the head, just so that they don't have that problem. So, it can happen. It's rare. Not a lot of people will have that issue. Inferior to the ear. Okay. And this is defined as the notch posterior and inferior to the ear. So, of course, your external opening of the ear is here. If you go down, straight down, it's the angle of the jaw and back to the mastoid process. So that's the area that they're talking about. This one contains the external carotid artery, facial nerve, better known as cranial nerve 7, and this process called the styloid process. And that styloid process can be seen. Styloid process is a little small bone that basically descends. It's only about maybe an inch long, and it's for actual muscle attachment. And it's an area that can be tender. If you're massaging up in that area, in the suboccipital area, sometimes you can, okay, on page 26, at the very top right-hand corner, it shows the styloid process. In fact, there's an enlarged view of it in the middle of that page as well. But that little process is for muscle attachment for a lot of the muscles in the submandibular area that come down, that control like tongue motion, for instance, swallowing, that kind of thing.
So is that about the middle of your skull there?
That, I know, it's a little hard to, you can actually feel it if you push in on this area, and you'll know because it's a little tender. Yeah, you go right, the angle of the jaw, go right behind it and push in that area, you'll feel some tenderness in there. And that's when you know you're actually hitting on that styloid process.
Looks like a long, tiny bone.
It is. It's very narrow.
It's fragile. It's very fragile.
Yeah, you're right, it is. It's a fragile bone. But that's where many of the muscles attach. There's not a great picture of that in your book. Usually that's a muscle that they talk about more if you're in the dental field, for instance, then you study all of that area. Or estheticians, for instance, they have to know a lot about that particular area. So that's inferior to the ear. And as we go backwards, we have the posterior triangle of